All right. Well, here waiting in case anybody from our group, COPD Navigator, here on Facebook or our YouTube channel has any good questions about COPD, COVID-19, all that kind of fun stuff right now. If you're tuning in on YouTube, my name is Mike Hess. I'm a respiratory therapist. Been a COPD advocate for a good number of years now. Trying to get people to understand how this disease works, how to manage it, manage symptoms better, update people on regular updates. Oh, not used to having headphone down here, so I was getting a little bit of audio, and I was surprised by that. So, at any rate, what I usually do is a bi-weekly show. Every Wednesday or every other Wednesday, 4 o'clock p.m. Eastern Time, called Brief TV. And what we do on there is we have some news of the last period, last 2 weeks usually. We have a lesson plan, like last week's episode was all about the role of inflammation in COPD. And then we do some questions and answers. And I've had a lot of people also have a Facebook group. Hey, Sam and Linda, thanks for checking in. Appreciate it. Had a lot of discussion in our Facebook group, also called COPD Navigator, that there are a lot of folks who are having trouble accessing some of these questions and stuff now because as we are here in Michigan, a lot of places are on a lockdown of varying severity. So a lot of pulmonary rehabilitation programs are closed. A lot of clinic offices are closed to outside of emergency visits. And so it's difficult now to get people the answers to basic questions. So I thought I might try to pick up some of that slack. And of course, can't offer medical advice or anything like that to your specific case. But I am happy to answer general questions about what best practices are. Answer questions about this coronavirus deal, answer questions about inhalers, basically all the kind of things that you might get from a primary care visit or a pulmonary rehab visit, things like that, but can't access right now. Again, not specific to your individual case, cannot provide medical advice, certainly not on Doctor's Day. Happy Doctor's Day. Such as it is happy to everybody out there on the front lines. Love my ER docs, love my ICU docs, love my primary care docs. I get to work with a fantastic group here in Kalamazoo. Very proud of the work that everybody is doing, maintaining themselves on the front lines. Also, a shout out to all my respiratory therapy friends, and of course, a lot of my nursing friends out there. Phil checking in. Good. It is late afternoon here. We're starting at the 4 o'clock hour. Seemed to work pretty well for the usual scheduled program, so I thought this might be a good time to do it. I had the idea earlier today, so I'm not expecting a lot of folks stopping by, but also wanted to give an outlet to bring people together to be kind of social with some of this stuff. You know, a lot of times we talk as clinicians about the benefit of pulmonary rehab for exercise, but it's also a great way to commiserate with folks, you know, to get tips in our online group here. We have a lot of people who are at different phases of COPD, who have gone through a lot of different things, a lot of different of the what we call the phenotypes, the symptom groups, and that sort of thing. And what this does is gives us a chance to do what's called peer-to-peer counseling, where you know, I tell people a lot, I don't know what it's like to live day in, day out with shortness of breath. And so I'm not going to tell you I know how you feel, because I don't. And I think that's disrespectful. But there are a lot of people that do. And that kind of counseling can be very helpful. That kind of education. A lot of times people don't like the word counseling for whatever reason, but um, it is definitely a great way to pick up tips and to learn that you're not alone out there. So that's hopefully another thing we might be doing with this is giving people a little bit of a social outlet as we're all stuck in our living rooms and basements and staying 6 feet away from each other and all that kind of stuff. So. Valerie, so far so good, doing okay. Everybody I know personally is doing all right. I know one of my Facebook friends did have a scare recently. Thought she was coming down with it, but ended up testing negative for the COVID disease itself. So that's the good news. I do know that there are a lot of people who are exhausted, who are tired, who are scared because they don't have enough personal protective equipment. Don't know anybody who's stealing it or anything like that. But I do know that there are a lot of people who are already at the kind of the edge. And unfortunately, I do think this is going to continue in most parts of the country right now. We're still on the upswing. We're starting to get the real steep part of the curve here in Michigan. The last couple of days, we've added about 1,000 cases a day, even with relatively limited testing capability. So I don't know how much is out there in the community. But so far, so good. We're hanging in there. Sam is a fantastic advocate for a lot of chronic lung diseases and an inventor. If you're ever having trouble with your oxygen tubing, especially portable oxygen tubing, Sam has a fantastic device called the O2 Safety Strap, and I would highly encourage you to reach out to him or to do a search for O2 Safety Strap. I bet I can even talk him into dropping a link here in the comments. This will definitely go a long way to making your oxygen use a little safer and support some of the chronic lung disease family. So Sam asks, what are pulmonary rehabs in Michigan doing to help patients while the coronavirus is surging? Telemedicine, perhaps? Well, that's a great question because what we're seeing, this is kind of a quirk. I don't necessarily want to say a quirk in our healthcare system in the U.S. because I don't know a lot about internationally to say whether they're doing this more effectively or not. But we don't have a very well centralized response because we don't have a centralized healthcare system. We do have some disaster capabilities and things like that, but all across the state, a lot of these facilities were inconsistent with when they closed, what services they were offering, and things like that. So some places are doing telehealth. I can tell you that there are a couple of different online programs out there. We talked about this a little bit the last time we breathed TV. There are a couple of different groups out there that are dealing with home health stuff. There are a lot of non-pulmonary rehab oriented groups that are putting a lot of their programs online for free. A lot of our local gyms are putting programs online or on YouTube or on channels where you can subscribe, like sometimes like a video conference, but also other times just live streams like we're doing right here. Sorry about that. There's yoga, there's weights that you can do around the house. I know Russell Winwood from Australia, a COPD athlete, he's been doing a lot, just encouraging people, go up and down the stairs a time or two if you're capable. The last thing you want to do is lose any of the gains that you may have made inside the pulmonary rehab program, because I know myself, we've had limited activity where I've been to the store once in a week and I'm not anxious to go back. I see there's a question about anxiety there coming up. It's not so much anxiety for myself, but it's nerve-wracking to be in that situation, even as somebody without chronic lung conditions. It was eerie. I went to the store, and I've been kind of joking about this on my personal Facebook page and with my family. We play some, post-apocalypse games like Fallout and things like that, and you hear the remnants of civilization are these things going, like PA announcements and stuff, and going to the grocery store and hearing CDC warnings and stuff. It's off-putting, and I'm going to skip down a little bit to Linda, who mentions with dealing with anxiety, and it is anxiety provoking. And one of the ways you can kind of get around that is to try and avoid some of the news, maybe cut down on some of your news consumption. I know I'm an administrator of a couple of respiratory groups, and one of them has said, we got to take a breath here and there. We've got to get away from the COVID stuff. And that's good for a couple of reasons. I think, first of all, one of the things I've been trying to impress upon our public health apparatus here in Michigan is that, yes, COVID is a bad situation, and yes, it is causing a crisis, and yes, we need to pay that a lot of attention. But all the other stuff is still here too. We still have COPD. We still have asthma. We still have pulmonary fibrosis and pulmonary hypertension and cystic fibrosis. And we have all of these other issues going on. They haven't stopped. And we need to continue to make sure that we're taking care of these populations too, so that they don't add to the crisis. One of the things I've really been pushing, and if anybody is on Twitter, if you want to help me amplify my voice, I'm posting right now. Most of my stuff is going through, it's called Mucofile. It was an old name that I thought was kind of catchy. I'm really trying to get our state to recognize that we have a lot of these issues, and particularly in the face of an albuterol shortage, we need to relax some of the formulary restrictions so that we can get people the medications that they need or make easier substitutes. Here in Michigan, we just had an executive order that is relaxing some of our practice standards and protecting people that are trying to work outside the practice or coming from other states. For example, a respiratory therapist with an active license in another state, and now the barrier to coming to Michigan to practice to help out at some of our overwhelmed hospitals, that's lowered. But we still need to make sure that we're taking care of the people who are here and the people with these chronic conditions, so we can avoid having you folks add to the problem. I mean, we've got the last thing we want somebody with COPD to do is to end up in the ER exposed to all the other dozens of COVID cases out there because they couldn't get their inhaler refilled. That's going to be a huge ripple-on effect. And if I can get anybody to I'm actually, if you'll pardon me for just a second, I'm going to try to pull up a website because what we also need to do, we need to be tweeting, we need to be emailing, we need to be reaching out to everybody who can hear our voice right now to make sure that everybody is understanding what the issues are. So I'm going to drop this email address into the link here. Hopefully that'll work. We want to make sure that this is the email address for our Department of Health and Human Services. So particularly if you happen to be a Michigan resident, if you can help me add my voice to, or add to my voice to make sure that we're getting people the medications they need so that we avoid getting them into the ERs and all that stuff, that would be fantastic. Again, we can tweet, we can do a lot of stuff going on. Jim, hello, thank you. Hopefully you're still with me here on YouTube. Again, if folks, again, we do a fairly regular show, and I'm looking at doing some of these house calls on a fairly regular basis, potentially every day if there's enough interest, just to get the information out there. But you can also join us on YouTube, and you generally, you might have to make an account to make a comment, but you don't have to make an account to get the content. So if you are a little bit hesitant to jump into the Facebook world these days, as there's a lot of controversy with Facebook, check us out on YouTube. Joe Morrison, another huge COPD advocate, runs Right to Breathe, a fantastic organization that does a tremendous amount of advocacy, often in the Northeast, as I believe his home base is in New Jersey, but they do, Joe's a race car driver of drag racing. He's a drag race driver. And he uses that platform to help advocate on behalf of the community and has done some fantastic events. Great guy. Finally got to meet him. I think it was last summer already. I can't believe it was 2 summers ago, was it? Time's been flying. Until about 2 weeks ago. But great guy, great organization. So check out Right to Breathe. Joe, if you want to drop one of your links in the comments there, that would be fantastic. Throwing another kudo toward the O2 safety strap. They love it, making sure it's a huge difference. So Linda, just touching back with the anxiety again a little bit. Again, kind of being careful, being selective in what media you're consuming, looking for positive things, doing things as socially as you can. That's again one of the outlets that I want these things to do, is to try and provide some kind of social outlet for a lot of people, because this is one of those things that it does seem very doom and gloom, and it's very easy, as I mentioned, it's really easy to get caught up in a lot of that, even for someone without a chronic condition. Um, but by and large, we are going to get through this. This is, we've overcome things like this in the past. There will be another side, and I'm hopeful that we can learn a lot from this situation and do better the next time, and also translate that into doing better for, again, the chronic communities. This is kind of highlighting a lot of the faults in our system, so hopefully we can figure out how to work together to make that better. And so there's a lot of positive things that are going on too. Um, Also, the idea of dealing with anxiety while outside of this situation, we've had a whole episode devoted to this too. It's okay to admit that you are feeling anxious. It's okay to be nervous or upset or down, all those things. Our society has kind of evolved. I'll soapbox for just a second here. Our society has kind of evolved in two different ways. First of all, that a mental health condition like anxiety or depression is somehow your fault because you're not good enough, or you should be tougher or something like that. And nothing could be farther from the truth, for one thing. Um, for those of you who have been part of Navigator for a long time, you know that this community has been a huge inspiration to me in my health journey. I've struggled with obesity for many years, and this community helped me realize that I wasn't practicing what I was preaching, and I should do a better job of that, basically. And so it helped me get my health right. But again, it's recognizing that there are still a lot of positives out there. It's really easy to get caught up in a lot of the negatives. Um, Sometimes you have to go look for them, and sometimes it's impossible to find. And again, that's okay. Admitting that you're having difficulty finding the positives and going out and asking for help, whether it's counseling help, whether it's pharmacological help. I'm not always the first one to jump to meds, but sometimes there are chemical imbalances inside the head. That's the other path that we've kind of split off in this idea that mental health is completely dissociated from physical health is also not true. Sometimes there are actual chemical imbalances. Again, going back to kind of the obesity issue, sometimes the obesity mass, and my wife can talk a lot more intelligently about this, can cause a lot of that depression. It can cause hormonal changes in your body that make you be upset and make you be frustrated. And then again, when you talk about things like in COPD, many cases are caused by smoking, and by the time you get diagnosed, you often think, well, I should have known better than to smoke. And we as clinicians don't do a very good job a lot of times of trying to overcome that. And we don't teach that may be, but it doesn't do a lot of good to feel guilty about it. And we often add to that guilt by saying, yeah, you should have known better. You should have quit smoking a long time ago. You should have, or just quit, or, just cut down, or all those things. We don't, as clinicians, we don't do a great job at that. So it's really easy to get caught up in a lot of this stuff, but it's also important to try to break that cycle. So sometimes it's as easy as going for a walk. Sometimes it's as easy as watching some funny videos on YouTube. We talked about YouTube for pulmonary rehab. There's a lot of humor out there for pretty much any audience. Some of it is nice and appropriate. Some of it gets a little raunchy and maybe, as they say, not safe for work. So depending on what you like, there's something out there. It might just be a couple of videos that make you smile, something like that. Talking to a friend, talking to family members, talking to whoever. Everybody's got their own way to cope with stuff, and there's a lot of different ways to do it. So Pulmonary Wellness Online Boot Camp. That's another good online program. Also put a plug out there for Lyft. I did an interview with them a couple years ago and not compensated by them in any way, but you may see my face pop up. So full disclosure, I did an interview with them. Home Rehabilitation Network out of New York. They're an excellent facility. I've met Alexander, the gentleman that runs it. He's very passionate and very enthusiastic. So I encourage you checking out Home Rehab Network. Catching up, I saw Sam pop this up a little bit a while ago. Purple nails. Yes, they're starting to get a little bit worn down a little bit here, but my daughter likes to do my nails, and I kind of like having them done. So it's been kind of nice. This side is white nails. This is a new line from a company called Hollow Taco. A very great YouTuber that comes up out of Canada. She did makeup tutorials and stuff for a while that my daughter really liked, and then she ended up coming out with her her whole line of her own makeup nail or her own nail polish line. So let's see, what do we got from? All right, so I'm gonna. All right, let me see. So I'm going to drop another email address if I can. All right, Joe, if you're still watching, I wouldn't mind if you can drop that. I don't know if I can share the picture or not easily. I'm going to try. Well, I tell you what, I think I can share it to the page here. So Joe Morrison, who I mentioned runs Right to Breathe, is also doing some online seminars. So I'm going to, that's going right to a message. So let me see if I can save it. This is a complimentary, and I just covered it up. Complimentary virtual patient support hosted by Michelle Da Silva, who is a respiratory therapist and another great resource from Right to Breathe. She's going to be doing this tomorrow. From 4:30 to 5:30 or 7 to 8. Live Q&A from the experts. She's got the latest on various respiratory medications, COVID-19 updates. All you need to do, it is free. And if you what Joe is mentioning here is if you email breathe@righttobreathe.org, which hopefully I can, if I don't mess it up too badly, I can get that. And I don't want a sticker. I will get it on the COPD Navigator Facebook page itself. We're going to get that picture up there, and then you can, it's a free web conference, but you do have to get a link to register, and you get that by emailing breathe@righttobreathe.org. So I just need to go do the right number of clickies here. There it is. So we'll get that. That is now posted on our Facebook page. And definitely check that out. I'm sure Michelle will have all kinds of fantastic information for everybody tomorrow. So 2 summers ago already. Yeah, like I said, I'm a little bit slow scrolling behind. Got kind of into a lot of the anxiety stuff there. But Gabby, also great suggestions. Mindfulness using grounding techniques, useful for anxiety during this pandemic. Can find information and examples free online. For those of you who may not know, Gabby Davis is another outstanding resource. I know I'm throwing that phrase around a lot, but Gabby is an expert in nicotine and vaping cessation. She is in training still, I think. I don't think she's quite graduated yet, but to be a counselor, which helps a lot with doing nicotine and vaping cessation the right way and not making people feel guilty about it and all that stuff. And one of the smartest and most caring people I've ever met. So definitely the idea of mindfulness, which is difficult for me to explain easily, but grounding techniques, and again, just kind of being centered and calm and a lot of these things, you can probably find a lot of like meditation type of resources, you can probably look up mindfulness and get a fair bit of information, like again on YouTube or something like that, so that you can. A lot of it you'll find is very similar to breathing techniques, and there's a lot of overlap between breathing techniques and mindfulness, and even some pulmonary rehab stuff. The idea of pursed-lip breathing is great because not only does it have a physiological response where you're flushing out some of the stale air, but it also causes you to focus a little bit more and to be more in the moment rather than focusing on how short your breath is and working that cycle. And as you're doing that, you start getting into this whole mindful breathing routine, and that can help calm you down a little bit more too. So again, very, very superficial aspect of that. I'm sure Gabby would mention more of that. Shar asks, in the States, are RTs allowed to prescribe inhalers? It's a very gray area in most cases. Sometimes we can get standing orders and things like that, but we do not on our own have prescriptive authority at the moment. There is some language in some of the new executive orders that I don't know how we're going to implement it, but it's a possibility, and it's certainly something that we're fighting for because we're hoping to at one point become at the same level as our friends in the nurse practitioners and the physician assistants and have that prescriptive authority, but at the moment we are not able to do that directly on our own, no. Which I know I'm biased, but I think is silly. Okay, so also, again, kind of scrolling back here, video conference, going back to Joe's Right to Breathe stuff with the virtual patient support. If you go to their Facebook page and again, Right and then the numeral 2 Breathe, you can find the events on their Facebook page also. So you can find a link to their flyer on the Navigator Facebook page, COPD Navigator, and you can find links to the event itself on Right to Breathe. So Gabby, it's got all kinds of great additional information here. So many mental health clinicians are doing telehealth now specifically for anxiety and stress during COVID. Fantastic. Also check out, for those of you on the clinical side of things, your employer assistance programs. I shouldn't limit that to just clinicians because I know a lot of general companies are also doing this right now. So the employer assistance program can often hook you up with some kind of mental health support group or practitioner. Gabby also goes on to say, talking more with patients about anxiety, stress, and depression associated with their disease versus explaining about the physiological aspects of lung disease, so important and impactful. Yes, absolutely. In my cursory experience with that, working through primary care, a lot of times I found that whatever the condition is, sometimes you just want somebody to talk to or to hear you, I guess is probably the better way to put it. Sometimes you just want somebody to hear you. And I know in our, again, not to be too soapboxy, but in our healthcare system right now, we don't really allow much time to listen, let alone to hear. And that's an issue. We've got our 90 seconds to go through the problem list, or another 90 seconds to make a medication change, another 90 seconds to yell at you about quitting smoking. We don't really have time to talk about how difficult a lot of these things are. And so I think that's why, Gabby's absolutely right that it is so important and impactful, because when we're able to take that time and we're able to say, yeah, that does, pardon my French, that does suck, but I'm here to help you and I'm not here to judge you. And I want to give you the tools that you need to manage your condition appropriately. That is really powerful to me. And again, I don't think I've had nearly the experience that she has with it through her training. But I know if I've got this much and I know how big it is, imagine if it's, this much. So wholeheartedly agree. Make sure that you're taking advantage of whatever things that are out there for you. All right. So scrolling back through other comments here that I'm sorry I've missed. They don't all, depending on where you're watching, sometimes they have stuff. So Jody asks, we are currently not in this situation, but do you think we will be in a shortage of inhalers for our COPD community due to the fact that COVID-19 patients will have to be switched to MDIs? Yes, absolutely, I do. As of about a week ago now, according to the American Society for Health System Pharmacists, we are actually in, at least for albuterol, we are in a shortage condition. And again, if you give me just a second for this other page to load here, all shortages, I'm going to see if I can do something kind of fun here. I'm going to see, because I should just be able to, well, I don't know if that's going to, well, I can't do that. I can't be that cool on the fly. Sorry about that. But I'm looking here. We've got all kinds of shortages, even more in the last couple of days. So, okay. So now, okay. So those are from, okay. As of March 24th, albuterol sulfate meter dose inhalers are on a shortage. This is, let's see, that's a generic, that's a generic, that's a generic, Pro Air, Ventolin, and the generic Ventolin. Those are both, I guess the brand name, one of the brand name Ventolins is not on back order. Preventil is okay. And the dry powder inhalers, the Pro Air RespiClick and the Pro Air DigiHaler, those are not affected by the shortage. So yes, we are definitely having an issue. And again, the problem is it's not always very easy to switch brands. So, maybe Proventil is available, but if your formulary, if your drug company, your insurance company's formulary doesn't allow that swap, then there's about 8 layers of paperwork that we have to jump through. And that's really difficult, especially since most people aren't using their inhalers properly, which has been an issue for a very long time. And if people can't get their basic inhalers and can't switch, then, I mean, I have personally seen this where people end up in the hospital. And again, the last place we want to send somebody is the ER if they have COPD in the middle of a pandemic. So it's a real issue. So hopefully, again, I put that email address up there. Tweet with me. We can probably start being more aggressive with email or with Facebook and stuff like that. We've got to get people to understand. We've got to relax some of these formulary restrictions, or we're going to keep making the problem worse. We've been doing a lot to address the problem from the outside of the system and trying to do this physical distancing. We've been trying to do, keeping people at home. We're doing these things where we're making it easier for people to practice across state lines, but we're not doing some of the low-hanging fruit stuff. And I have my theories about why that might be. Usually that has to do with that, but be that as it may, it's an issue. So let's scrolling down a little bit here. I think I saw Judy. What's up, Mike? What do you think of all COPDers need to do to stay safe but still be able to see or talk to our doctors? Well, as mentioned earlier, there are a lot of docs who are doing telehealth visits, phone visits, all that kind of thing. I know in our practice, we're really trying to do video visits, which if you are signed up with your facilities or your practice's electronic system, whether it's My Chart, My Health, My whatever, a lot of times that has the capability to do video visits where, much like we're talking right now, you can communicate directly with your provider, ask them questions that are relevant to you. If you happen to have something like a pulse ox or something like that at home, they may have you put it on your finger and toss it up to the camera. I'm not going to use that finger that I usually use because that's just going to be rude. But you may do a thing like, come on, work with me a little bit here. So, trying to go around I should have used my other finger. I guess my other hand. That would have made more sense. You big dummy. So, you may come into a situation where you are doing something like this, where you're telling somebody how they feel. They're watching how you're breathing. They're watching how much you cough. They're listening to your cough. And they may say, well, if you have a pulse ox, why don't you go ahead and show it to me? So you put on your pulse ox and you do that. Phone visits are another option. Of course, it's going to be a little bit more limited. It's a lot harder to evaluate somebody over the phone than it is even with video. So those are things that the first things that I would look at. Well, really, those are the only things I would look at, because I would really only recommend going to the emergency room as a last resort at this point. Just because there have been so many questions raised over the last few weeks about how is this transmitted, how long does it stay on surfaces, things like that. Somebody asked a couple weeks ago during Breathe TV, how long is this going to last once the normal distancing guidelines are required? How long is it going to last for people with asthma, COPD? And the basic answer for that is probably an extra couple of weeks on top of that to be absolutely safe, because we know this thing can stick around for days, I think even up to a week on certain surfaces. So make sure that you're staying safe. Make sure that you're continuing to take your medications as prescribed, as long as you're not in a shortage or anything like that. Make sure that you're not trying anything new that you've heard about on TV or on the radio or anything like that. There's a lot of stuff flying around right now. Some of it is very newsworthy. There are drugs that are used for things like lupus, and that's been talked about in a couple of different circles. Also fairly dangerous if you don't know what you're doing. But there's also been a lot of stuff like colloidal silver and all kinds of other therapies, and lemon juice and things like that. Be really careful that you're not going too far or at all really off the range of what's been prescribed for you and what your clinicians are aware of, especially without a phone or a video visit. If those options are not available, if you don't know if those options are available, give your provider a call. Their office staff should be able to point you in the right direction. Worst case, try to find some kind of urgent clinic or something like that is offering these things, and do what you can there. And those are really the biggest things. You do whatever you can to talk to a provider without actually having to go to that provider. I was reading an article in one of the not a journal per se, but some of the health-oriented publications that are out there, and said this is really the moment that telehealth is coming of age. This is where we're going to start doing a lot more of these visits, because again, it doesn't make a lot of sense to drag a sick person out of the house if we can have this kind of interaction remotely. And I can look at you, I can hear you cough. Someday we'll have the capability of, well, okay, so you've got your phone, you're going to put on this app, and then I want you to take the microphone and I want you to put it over this long. Okay, now I want to put it over this long. Okay, I can listen to your lungs now. You sound like you're wheezing. I want you to take some albuterol now, and then blah, 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 blah. We'll have that capability soon. Hopefully. It will roll out very inconsistently like everything else, but for right now, just do what you can with telehealth. Let's see what else we got here. It's getting to be a pretty good crowd. Appreciate everybody stopping by. James stopping by. Thank you very much for taking some time out of your Monday here. Hope you're doing well and staying safe. Sharon, hello. Robin, hello. Thank you. She says I'm doing a great job. I don't know about that, but check out Jim if you're still with us. Check out that O2 safety strap at the link that should be somewhere in the comments, or just to is it o2safetystrap.com? Yep, o2safetystrap.com helps keep your oxygen tubing secure and safe. So Catherine says, I used to be more active, but being that I'm in quarantine, I am eating more, not moving as much. I'm really bad at pushing myself to do exercises in the house besides clean. I try to make it a workout, but you can only do so much. What things can I do to build up my lungs in the house? I don't have a treadmill. I do walking around the table all the time. My dog walks with me. He likes it. Well, you've hit on one of the top things that you can do. When I mentioned earlier, I've had kind of a weight loss journey, And one of the things when I was toward the beginning, I was really competitive with making sure I got my steps in every day. And so we had there are DVDs out there. I think some of them are on YouTube to a limited degree. If Amazon's still working, I've heard talk about strikes and things like that, but Amazon has these things. They're fairly inexpensive. Um, Called the particular brand we had was Walk Away the Pounds, and you walk in place. Sometimes you do some extra things. You're doing these kind of stretches, or you're bringing your knees up higher, just to kind of vary things up a little bit. And those are. It seems simple, it seems silly, but those get you started on the journey. So 5 minutes here and there, once and start building up. Once you can do about 30 minutes without having to stop, bring some resistance into it. Sometimes people will have hand weights around the house. I don't think I have anything that really is terribly suitable for another demonstration, but you can use soup cans. I got some spacers. So imagine, imagine these are soup cans, and you can, while you're walking, you can hold them, or you can, do curls. You can hold them out. You can do kind of the butterfly thing. As you're building the upper body stuff, that helps strengthen what we call the accessory muscles of breathing, which are muscles, gravity, the accessory muscles of breathing, which are muscles that help your diaphragm, which sometimes gets a little bit weakened in COPD, helps take some of that load off and helps you breathe a little bit better. But again, you want to make sure you're working that cardiovascular stuff, and it can be just as simple as walking in place or walking around a coffee table with your dog. Sometimes it really is that easy. Whatever you're doing is going to help decrease any loss, maintain, or actually improve. If you haven't been to pulmonary rehab or you haven't done any of these things, they're going to help you improve. Russell also points out that singing is a great lung exercise too, because that brings in all kinds of stuff. It's usually fun. It's where you have to kind of monitor and be mindful of your breathing. So it's that mindfulness, and you're having a good time. And yes, you are strengthening a lot of these muscles. So that's a great point from somebody who knows what he's talking about. Singing, walking in place, and these things can all bring you a little bit of joy too. So it helps with that mental isolation kind of stuff. So all these things are great. Diane does point out lots of great exercise videos on YouTube. Absolutely. Again, I'm not partial or beholden to any brand. I speak to my experience. That's what we had. Frankly, they have pros and cons. I was not a fan of the person who led the exercise, so we tended to put on music while we were walking and doing all this stuff. And then you can watch as they change the steps or add the upper body or whatever. You can watch for those changes, but you don't necessarily have to listen to the cheesy dialogue and all that stuff. So here in Canada, more specifically in Alberta, Char mentions there are problems with doctors that are not always allowed to video chat due to billing conflicts. That's also true. That has also been true in the U.S. So a couple of weeks ago, as we were really starting to build into the crisis, some of those restrictions were lifted. Especially for our Medicare folks. I can't remember the exact ins and outs of it, but I do know that a lot of the telehealth billing codes were modified and relaxed so that we could continue, or we could start providing a lot of these visits remotely, because that was one thing that the public health system did see coming, was that the need for this kind of stuff. So that's good news. All right, so what else we got going on here? Michael checking in. Hope you're doing okay. Hope that your wacky neighbors and all that stuff are doing okay with you. Pro Air RespiClick is on back order from my pharmacy. I'm looking at least another week before I can get in my refill per my pharmacy. So the list that I had earlier is a national list that is done by to give them proper credit. Because I still don't think I can pull up that webpage, because I think the settings are wrong. So, I can maybe do, I can do that page specifically. So I bet if I do we're going to try something here. You guys can be guinea pigs with me. Browser that. Let's see what happens. If I do that, it doesn't work. Awesome. All right. So, oh, wait, there it is. All right. So I can control, oops, that's grabbing the wrong thing. I can control parts of it, and I'll see if I can scroll down a little bit. Don't think I can, so it's not going to give me the good bit of the web page, unfortunately. So, it doesn't work after all. No, not video capture device. Drug shortage. Okay, so I will drop, here's a link right into some of the comments here on the main video, and I will also drop it in the watch party. This website is part of the American Society for Health System Pharmacists, and they do a lot of, they list a lot of reports. I mean, they're not the manufacturers, they're not even the FDA, although I found them to be a little bit more responsive, a little bit faster on the draw than the FDA. They're reporting that as far as they know, widespread, there is not necessarily a national back order of some of these inhalers. However, each pharmacy, and I've come to learn this fairly recently, there's like 3 or 4 like giant wholesale warehouse distributor things that dish out to the various pharmacies. There may be a shortage at one, and if your pharmacy only gets their meds from one distributor, then they're going to have a back order. So, this is, I don't say these things, just like I have the disclaimer about this isn't necessarily medical advice and certainly not specific to your individual case. These are not universal solutions. This is not universally applicable. Michael is out in the Northwest somewhere, I believe, still traveling around. Maybe regional shortages, maybe those sorts of things that you do have to be mindful of. So scrolling back up a little bit, does nail polish affect your pulse ox reading? It depends on the case. In this case, for those of you who maybe missed it earlier, I had some nail polish, or I have some nail polish on, and I did a pulse ox reading. So on my one hand with the purple nail polish, and I'm actually going to use the one that's still mostly on the finger, I get a reading of 97% with a pretty good waveform indicator, 8.7. So if I switch it to the other hand that has white nail polish, let's see what I get on that. Give it a second there. So that's given me, oh, no, now bumped up to 97, 98%. So in this case, there is not as much of an issue. However, it has been known to happen. It's actually been kind of a source of controversy over the years for respiratory therapists, because it seems like it's one of those things like 1 year a journal article comes out that says it does affect it, and then the next year it's like, well, no, it's just black and green and red. And then the next year it's like, well, no, none of them work, or none of them affect pulse ox, and it's fine. A lot of variables, including what kind of pulse ox you use. This is a fairly, this is essentially a clinical strength model. It's the home version of the clinical strength model. Uses the same technology in it. There are cheaper ones. This one was fairly expensive. There are cheaper ones that you don't look for as many waveforms or wavelengths and that sort of thing. They may be easier to fool. They may get fooled by nail polish. So it is possible. In this case, no. And in most cases, probably not. But in some cases, it is possible, yes. So thank you, Denise, for checking in with that one here. Okay, Catherine, thank you very much. Heart goes out to all of you during this time. All truly on the front line. Be safe. Well, again, working in the outpatient world, I'm not quite on the front line yet. I anticipate my time is coming. So I will definitely be as safe as I possibly can when the time comes. And I appreciate you saying that. And please give a thought to all of my colleagues out there who are definitely out there doing the frontline stuff. That's really where my concerns are right now. I got a lot of friends out there who are dealing with this stuff on a daily basis. And like I said, I know I've had one, at least one that's had a scare already. Fortunately, she does okay with it. So, Sandra mentions, I am barrel chested. How do you fix it? Unfortunately, once that change has happened, there's not really a good way to fix it. For those of you who may not know, again, we talked about some of the accessory muscles of breathing, and I can't quite, see if I can go up a little bit here. Right about here is where your diaphragm sits, and that is your main muscle of breathing. And when that muscle gets weakened, or when your lungs get bigger, as happens with emphysema and stuff like that, your other muscles have to start taking over. And so these get bigger, and again, your lungs are bigger, and your chest kind of expands to fit some of that. There's not really a way to go back from that. Now, the physical part of it. Now, one of the other things is that can make it a little bit more difficult to breathe. And the way to fix that is to, again, strengthen these muscles up even more and fix that part of it. But unfortunately, there's not really a way to fix the actual barrel chestedness part. John Linnell, John checking in today, working with me on or I should say I work with him on the U.S. COPD Coalition, a fantastic advocate out there. Just heard now they are thinking ibuprofen may not be a med that exacerbates COVID-19. Why and how do the experts keep contradicting themselves in spite of understanding this is still new? Well, it's tough to say. Not every expert is created equal. Just like with every one of us, everybody has their own motivations and our own this and that. And it's also human nature to kind of say, well, we have this idea and we think it's going to work and it seems promising. And then if you've ever played a game of telephone, you know that once you've told 5 people, you've gone from we think it's promising to, oh, this definitely works. Especially when you start throwing into the mix, like I said, some other motivations, whether they're economic or political or what have you. Everybody wants to have the big the scoop and things like that, so that doesn't always help with media coverage. And this is the thing where we have a lot of trouble with research sometimes too, because we may have an initial group where a treatment works really well. And then we expand that out into a bigger, more varied group, and it doesn't work as well. That's not necessarily a contradiction. It's just, well, we had this in this group, it works really well. Now we're finding that maybe we something is different. We weren't accounting for some assumption, and so now things are different. It can definitely look like a contradiction. It can definitely look like, well, they didn't know what they're talking about. We go back to, there's that old joke about how, 1 year eggs are good for you, and then the next year they're bad for you. And then maybe it's, well, how many eggs are you eating? All that kind of stuff. Let's check on something real quick here. I saw a light come on. Oh, okay. I guess it wasn't coming on. I thought maybe my battery was dying, and I thought I'd plug the thing in. But we're doing okay. It's not necessarily contradiction, and it's not even necessarily intentionally misleading or anything like that. It's just new information. And in science and medicine in particular, new medication pops up all the time because we always find differences between people that we weren't always aware of. And like I said, it can look like contradiction and all that stuff. So that's an answer to the why, and an answer to, especially when you have a situation like this where there are a lot of unknowns, it's really important to not necessarily go with the first thing you hear, because any kind of breaking news story, and even though this has been going on for weeks now, it's still essentially a breaking news story because we are learning stuff all the time. You got to wait for it's the old, sometimes it comes down to the old saying about trust but verify. I mean, even when it comes from a normally reputable source, it could be erroneous, it could be incomplete. It was not necessarily any bad intent behind it, but that's just the nature of the beast when we're dealing with something that we don't know much about. And we have only known about this thing for what, 4 months now at best, known that it even existed. I mean, we can move pretty fast these days. I believe we have the genotype or the genome and all that stuff, which is well beyond what we could have done 20, 30, 50 years ago. But there's still a lot we don't know and a lot we're figuring out. Next week, they may discover that there is a subset of people that ibuprofen is absolutely worse for in this case, and then maybe there's a subset that it actually helps improve symptoms. We thought for a while we knew that this acted exactly like a condition called acute respiratory distress syndrome, or ARDS, and so we started treating people exactly like that. And then we found that it's often like that, but not always, and it has some characteristics of it, but not all. And so in the attempt to get the right answer quickly so that we can save as much tissue and save lives and all that stuff as we possibly can, sometimes we make assumptions and they don't turn out to be right. I don't mean to sound cavalier about it, but that's all it comes down to sometimes, is we tried and we were incorrect. And it's as simple as that. I wish I had a more satisfying answer, but so Denise, so grateful to all those in the medical field. Thank you. So Judy, I think, was this the same question? So a slightly different question from before, but can you prevent barrel chest with proper diaphragmatic breathing exercises? Often, I would say. I don't think that it is I don't think it's guaranteed, because it depends on what other kind of damage is going on in there. It's not the diaphragmatic issues are not the only thing that lead to barrel chest. So you can probably help. I would be very hesitant to say that you can prevent. Because again, every case is going to be a little bit different. Every case is going to be respond to different therapies. So diaphragmatic breathing can be quite helpful in a lot of people, but again, it's going to depend on symptoms and all that kind of stuff too. So I would say working with your diaphragmatic breathing is a good thing. I wouldn't ever discourage anybody from doing that, because it's much like singing. It can kind of tie in a lot of the good stuff, the mindfulness of the breathing, and the physiological good air in, bad air out can help with a lot of that stuff. Can it prevent some of those structural changes? I would be a lot more hesitant to say that. So. All right, I think I have caught up with all the questions, and we've been doing this for about an hour now, and this has certainly been a good experience for me. Well, let me scroll back to another. Susan checking in from Green Valley, Arizona. Hi, Susan. Glad you're able to check in with us on what is now in the afternoon show out in Arizona. So this seems like it's a fairly good idea at a fairly good time to get people some answers, and to hopefully provide you with some resources and stuff that you might not otherwise have access to right now in the dawn of. When we were doing Breathe TV the other day, we had we were talking a lot about the catchphrase is social distancing, but we're trying to get away and move more toward the idea of physical distancing, because we want to have this social interaction. We just want to make sure we're 6 feet away, right? but so it's one of our watchers. Um, who was it? I can see his profile picture. David, I think. Anyway, um, it's gonna bother me. In any event, he came up with the idea of calling it physical distancing instead of social distancing because we want to still have that social interaction. So we don't want to be distant socially. We want to be distant physically and still maintain that connection. So hopefully we're going to go along those lines now. Like I said, this seems like it worked out pretty well for most folks. So if you are down, I'm down, and we can do this for at least the next little while here. Make time to join us again tomorrow around 4 p.m. Eastern time or so. Again, you can check us out here on Facebook or on Facebook. We have a page, COPD Navigator. We have a group, COPD Navigator. You can follow us on Twitter up there. I haven't really been doing a whole lot with Twitter, but I think I'm probably about to. And you can also check us out on YouTube at COPD Navigator on that channel and take a look at some of our older recorded videos and all that kind of fun stuff. John, okay, it was physical distancing, not social distancing, because we need each other right now more than ever. Well, sorry about that, John. I want to give credit where credit is due. I was thinking it was not you, but I'm glad to hear it was you. John is, as I said, a fantastic advocate for someone living with COPD himself, but still takes time to fight the good fight, all the things that we're talking about today. So thank you very much, John, for checking in and for claiming that credit where credit is due. So we definitely need each other now more than ever, and like I said before, I know this is an anxiety provoking time. I've seen it myself, but we've got if we stick together and we stay informed and we continue to support one another, we will get through it. So all my good vibes, all my best thoughts, all that stuff going out to everybody out there in Navigator Nation and in COPD land. Like I said, this seems fairly worthwhile. So let's plan on meeting up again tomorrow at 4 o'clock. Tell your friends, tell your family, tell your neighbors. Help spread the word about COPD so that we're all working together and that we are all going to all beat this thing. So take care, everybody. Take care of yourselves. Take care of each other. We'll see you tomorrow.